All right, I wanted to discuss, I had a guest on this morning. His name's Tucker Goodrich. He talks about, the problems with linoleic acid, seed oil, so on and so forth. And that's not the point of this video. That's a good interview you guys should watch. We got into that in quite detail. That'll be on the Dr. Sean Baker podcast channel or the Rivero channel if you want to find that. That's where all of our interviews are. But the reason I bring up this particular topic, and stick around, I'll show you the ribs, how they're doing at the end here, because I mentioned that this morning. We're cooking up some ribs, some big old beef ribs, which look quite good. So here's the thing. So the reason I, sort of transition is Tucker put out a little thing talking about, some of us figure out what's causing pain and are able to relieve that. And this is basically in the context of talking to a guy named Layne Norton, who some of you guys know. He's very critical of everybody's diet, and he's a PhD and knows it all, right? And so he was talking about the fact that a lot of guys that are older, 40s, 50s, have pain, and he would rather be strong and have pain than weak, than weak and have pain. And that's a sentiment I agree with. I certainly think there's no, in my view, real downsides to being stronger. But here's the thing, does diet particularly have an impact on our pain, our levels of pain? As an orthopedic surgeon for years, I didn't think that was the case. It just didn't really dawn on me that it really did. In fact, not often, but I would have patients who would come in, I remember patients coming in saying, "Hey, doc, whenever I eat my bread, my knees hurt more." And I kind of dismissed them. Man, I don't know what they're talking about. Let me look at your MRI. Let me go, blah, blah, blah. That's why your knee hurts, not because of any silly diet you're doing. Subsequent to that, now I made to learn by listening to my patients that, hey, there's something here and we should listen to these folks. This is the whole kind of emphasis of what I do now. I listen to people, see what's going on, and say, hey, maybe we can learn something from their experiences. But 2020, University of Alabama puts out a study looking at knee pain, particularly osteoarthritic knee pain, in the context of different dietary interventions. And what do they find? Well, they find out that they compare kind of a standard diet to a low-fat diet to a low-carb diet. And you guys can see where this is going. The low-carb diet clearly had significant improvements in pain compared to the other two versions. It was, both in perception, ability to perform functional daily activities, as well as measuring certain inflammatory biomarkers. And so, yes, diet does have an impact on pain. Will it take it all away all the time? Probably not. In fact, probably most likely not, but it can certainly moderate it enough so you can enjoy your life. You can participate in things. As we get older, as we sort of, work our whole life and get to a point where maybe we're going to get ready to retire, we want to enjoy our more discretionary time. If you're always in pain, it's not good, right? It's not fun. And so I've seen in my own life significant diminishment in pain, with current, a little neck injury being an exception here. Of course, that's getting better. And again, once I said, I started on a higher fat ketogenic version of the carnivore diet. I'm still on a carnivore diet, but just a higher fat. And I have seen, a appreciable reduction in pain. Not completely gone, but I'm training, I'm lifting, I'm doing just most of the things I want to do. There's still a few things I can't quite do, but I'll get back there in the near future. So anyway, let me know what you guys think. Have you guys seen where diet has had an impact on your pain, your quality of life, your ability to function? I'd like to hear that in the comments. If you guys wouldn't mind, I always enjoy, sort of learning more about stuff, and it's quite interesting for other people that might be reading the comments too, that might be like questioning, is this something I should do? All right, guys. Oh yeah, the ribs. So the ribs are turning out pretty good. I still got about an hour. They're probably about 170 degrees right now. And this is what they look like. And so, they're going to be good. I'm looking forward to it. You guys take care.